Hello, 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 everybody. Welcome to the Kathie J Show. Hello, it's so good to see all of you. I'm Kathie J. Thank you for spending this half hour with us. You know, we work hard to bring you topics that you really care about. You're sending us viewer emails saying, I want to hear about this and this and this, Kathie. We're bringing you the experts so that you can get that information. So thank you for staying up with us. Remember, you can get anything that you want, catch up on anything at kathiejshow.com. Real fast before we get into today's show, it's February 28th, so I have to take a moment to give a little special birthday shout out to my mom, Kathleen. There she is right there. Happy birthday, Mom. I love you so much. There's my two little daughters with her. My mom is just the light in my life, and she's taught me so much, and I just wouldn't be here without her. So I'm sorry I don't have the manners that you hoped I'd get, Mom. But you know, there's so many other things, positives with us. But you are my world mom, and I love you. Happy birthday. All right, so today's topic, everybody, it's a very important one. So hang in with us this half hour because we're going to get into it. We're going to talk about cancer. And yes, blank cancer, absolutely. I am there with you. I've lost loved ones to cancer. Today, we're devoting our show specifically to cervical cancer. So did you know that cervical cancer, ladies, will impact about 14,000 women this year alone, with over 4,000 of them actually dying from it? That's way too many women. All women are at risk for cervical cancer, and to help open up the discussion, we invited a gynecological oncologist from the University of Colorado and CU Cancer Center to tell us more about it. Everybody, please welcome to the show, Dr. Lindsay Brubaker. Thank you so much, Lindsay. All right, Dr. Lindsay, let's get into it. Show everybody your shoes really fast because then we're going to get into the, look at how fabulous those are. My director loves them. All right, thank you so much. I love you for being here.
Thank you for having me.
So cervical cancer, if so many of us are going to get it, what is it? Where does it go? It's right there, right?
Yeah, so the cervix is the entry to the uterus. Okay, so it's at the top of the vagina for any person who has a uterus and a vagina.
Right.
You know, the thing about cervical cancer is it's truly a worldwide issue, okay? And we definitely see, like you said, 14,000 cases a year in the United States, but globally, cervical cancer is a leading killer of women around the world.
Really?
The incredible thing about cervical cancer, though, is that we have a vaccine to prevent the virus that causes cervical cancer, and we have excellent screening options.
Yes, we do. And one of the problems about cervical cancer, is that there's no symptoms, correct?
You know, early cervical cancer very rarely has symptoms. It's most commonly picked up on one of the screening methods, either on a pap smear, usually on a pap smear or one of the tests that come after an abnormal pap smear.
Okay. You mean, I'm sorry, I didn't mean to interrupt.
Yeah.
When we get you have some extra white blood cell or white cell count or whatever that is. Or
abnormal cells.
Abnormal cells, yes. I've gotten some of those reports, so yes, where you got to go back.
It's very common.
Totally, right.
But when you have more advanced cancer, you can have symptoms actually. And so you could have bleeding after intercourse. You could have abnormal bleeding where like between menstrual cycles, you have a little bit of spotting.
That's most women. A lot of women are saying right now, oh, okay, this is bad.
Yeah, no, it's something that if it's persistent, it's worth talking to your doctor about.
Okay, definitely. So this also has to do with the fact that, like you said, all of us have the cells that can turn into cancer, correct? Okay, and so we'll get into the HPV vaccine a little later, everybody, because that is the vaccine that can help you prevent like 6 different cancers, right? Okay, but the cervical cancer, I want to get into it a little bit more because you were saying that it's definitely, when the cells get moved around in whatever kind of way, that's when they can get active and that's when the cancer can start forming. Is that kind of it?
So there's a virus called the human papilloma virus, or HPV, that's extremely common. Some 80% of people will have it in their lifetime. And it's particularly common among reproductive age people.
Okay.
Often your body will clear the virus on its own and it will just go away and it's not an issue.
How amazing.
However, it is. Our bodies are incredible.
Yeah, they are.
However, when it becomes more persistent, it can lead to changes in the cells in the cervix that can cause precancerous changes in those cells.
Okay.
And there are a few particular strains, because there's some 100 strains of HPV.
Wow.
And there's strains 16 and 18 that are highest risk for causing precancerous cells changes that can then lead to cervical cancer.
Got you. So it all starts with HPV that we all have, 80% of us have it. Then it can, how it mutates throughout what we're doing in our life, right? Okay, so we'll get into that a little bit more, everybody. When we come back, what screenings do women need for cervical cancer and more of those symptoms? Dr. Lindsay has it for us. We'll be right back. Ramos Law is an official partner of the Kathie J Show. He's a medical doctor and a lawyer. Ramos Law, what makes us different makes us better. Hello, welcome back to the Kathie J Show. So today we're talking about cervical cancer in women, and Dr. Lindsay is here. Dr. Lindsay, thank you for being here. Now, so we were just discussing HPV as a virus, is where it all starts. Right. And I loved it. She just said in the break, HPV is a transient. It likes to go through us in all different ways, and it's hanging out with us. And so when cervical cancer comes along, the HPV, do we test for HPV? How do we know that we even had it to begin with?
We do. So now, essentially, starting at age 30, we recommend HPV testing.
Is it
for
a blood
women.
test?
No, it's part of the cervix test, like the pap smear test. Okay. So the pap smear actually looks at cells on the cervix, whereas the HPV test looks for the actual HPV virus, and specifically for the highest risk strains of HPV.
So if women out there are over 30 right now, should they say, do I need to go in and say, I want to test specifically, in addition to my abnormal cells, test for HPV?
So in general, the way the recommendations are supported at this time is any woman over age 21 should start getting pap smears. But we don't generally recommend HPV testing from age 21 to 29 because HPV is so common. And the vast majority of patients will actually clear it on their own.
Right.
And usually that's done every 3 years if you have normal cells on your pap smear result. Once you hit age 30, some recommendations like the American Cancer Society say age 25, you can start HPV testing in addition. And so it's those tests either in combination, and more recently we found that even the high risk HPV testing alone may be sufficient.
That would be awesome for so many women out there if we didn't have to do the pap test and you still got to go in there to get the HPV test.
The pelvic exam. Sorry.
We're still getting that kind of a visit. Never mind. All right. You're down there. Take whatever test you need. So do people find that, so they do the pap and the HPV at the moment? They co-test?
Yes, they co-test, exactly. Starting at age 30 now up to age 65.
So how often should women get screened after 30?
If you're getting the co-test, it's every 5 years if your tests come back normal. Of course, if you have abnormal cells in that process or an HPV positive test, you may need to be seen more frequently.
Okay. Is this genetics? Do I have to worry about it if my
No.
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 Wow.
Yeah, it's really driven by HPV, like we've talked about, which is common, and if it persists is when you see the precancerous changes in the cervix cells. The other thing that can increase your risk is smoking cigarettes, unfortunately. Leads to twice the risk of cervical cancer.
That's what I was just going to ask you. What are some of the things that can lead to smoking?
Smoking cigarettes.
Smoking cigarettes.
Yeah.
Okay. Over the last 40 years, deaths have actually gone down more than 50% because of the screenings.
Yeah.
So this is preventable. We don't need to be losing our women.
Oh my God, yeah. Between screening and between the HPV vaccine, there's so much we can be doing to getting ahead of cervical cancer.
And guess what, everybody? Thank you, Dr. Lindsay, for that. When we come back, we're going to get into what we can be doing to prevent cervical cancer. We'll be right back. Oakwood Homes is an official partner of the Kathie J Show. Oakwood Homes, building happiness. Welcome back to the Kathie J Show. So HPV, the human papilloma virus, I said it right, is a common virus that can cause 6 different types of cancer, and one of them is cervical cancer. Everybody, Dr. Lindsay is joining us today. Yay!
Thank
tell
you.
us all about this. So Dr. Lindsay, 8 out of 10 people will get HPV at some point in their life. Is that cute? Is that true?
Yeah.
Wow.
Yeah.
Okay. So, and if 80% of us are walking around with the virus, I guess that can happen. you said one of the big symptoms, I want to just repeat everybody for all you women out there, the bleeding is a big thing. Even spotting?
That's the most common. Most common would, if somebody were to have a symptom of cervical cancer, it would be spotting, particularly after intercourse.
Okay, right. I was going to say, don't write it off that you're stressed, ladies, but now that I know it's after intercourse, I feel bad for you. Like, that's bad, but so many of us would write it off. Like, something must have happened while we did that, and I'll be done with it. But go and get it checked out. Prevention is what it's all about, everybody. 14 million people in the United States, including teenagers, get infected with HPV each year. And HPV infection has no treatment, but the vaccine can prevent it.
Exactly.
So now let's get into that HPV vaccine. Okay, what are we preventing? What kind of cancers?
So just to specify one thing quickly, because we did talk about how 8 out of 10 people can have HPV.
Yes.
And like I mentioned before, there's 100 strains of HPV. We know there are certain strains that are higher likelihood of causing cancer.
Okay.
And so that's what the HPV vaccine targets.
That's what we want.
Right? So the most recent version of Gardasil, which is the HPV vaccine, covers 9 strains of HPV, including 16 and 18, which are the highest risk.
Okay, that's awesome. So other cancers that we're talking about, throat
Yes.
cancer.
Throat.
Yes, right.
Penile cancer, anal cancer, tongue cancer, cervix cancer.
Wow, vulva?
Vulva also, yes.
Oh my goodness, there's so many that you'd never think about.
Yeah.
And no one wants that. I mean, you have children, you don't want that for them later in life. If you can knock out some cancers, and also boys can get HPV. They can carry HPV and have cancer from that as well.
Correct.
And what are those cancers that you're helping prevent your sons from getting?
That can be penile cancer, anal cancer, throat cancer.
Doesn't sound good. None of it sounds good, everybody. So this is the reason why we really wanted to talk about this, because the HPV vaccine came along after I was too old for it. And so it targets kids. What's the age group?
So the CDC recommends between age 9 and 12.
Age 9 and 12.
And the goal is, because the whole intention of the HPV vaccine is to prevent HPV infection. And therefore it has to be given prior to any possibility of exposure to HPV.
Okay, and the exposure could come like if someone was getting sexually active into their teenager years and all that, right? So that's why we try to isolate 9 to 12.
Right.
What if you've been sexually active and you're a teenager? Can you still get the HPV vaccine?
Yes.
Okay, so it's not like anybody's counted out by any kind of lifestyle.
No, we just know that it's going to be the most efficacious because it will be prior to any exposure if it's given, and it's very safe to be given age 9 to 12.
Okay, there are some misconceptions I feel about HPV. The biggest one is, oh, my kid's going to be infertile if I give him the HPV. Please address that.
Yeah, there have been many studies done on the HPV vaccine at this point. There have been some 270 million doses of this vaccine given.
Wow.
And the FDA and CDC have been following for any sort of adverse events. That's worldwide. In the US, it's like 130 million doses. But for the past 10 years, we've followed up on patients who have received the vaccine and seen very limited long-term side effects, if any. And fertility certainly is not one of them. And honestly, as somebody who provides care for women with cancer, a patient with cervical cancer is far more likely to lose her fertility because of the cancer, rather than from the vaccine. Like there's zero association between HPV vaccine and infertility.
Thank you.
And if anything, you are protecting your ability to carry a child by getting the HPV vaccine.
Yeah, that's exactly right. Okay, now let's go over to men, because a lot of times people are like, men don't need it, men don't need it. They should want it, not only for the cancer thing, but then they don't want to eventually give it to a partner, right? How does that work?
Same thing, because if you decrease the spread of HPV within our communities by vaccinating everybody, the incidence of cervical cancer and even like pre-cancerous processes will go down in the population. And we're seeing that in places like Australia, where they have integrated HPV vaccination into their school vaccines. And they're actually seeing a decrease in the pre-cancerous lesions in young women in that country.
That's amazing. That's wonderful.
Awesome.
That's what we want. I mean, isn't that the purpose of science? We want to help the next generations so that they don't have to have the cancers and stuff. You see the women that have to go through the chemo and
the surgery.
It's horrible, right? Yeah. I mean, you were telling me some of the stories when they have to go through both. You now have a system, though, because it's so sensitive. You walk your patients. You don't leave them once they go into chemo. You're there with them through the whole process, correct?
Yeah, you know, gynecologic oncology is pretty incredible field to be a part of, because
yeah.
we both do the surgery for our patients and we provide their ongoing chemotherapy care and then follow-up after their diagnosis.
Which is not normally. Normally you do, here's your doctor over here, and then you deal with your cancer doctor over here, right? So you understand that this just happens, it's because obviously it's so sensitive. And women over the years probably said, I felt like a number, and so I needed the bedside manner of my doctor. Is that kind of it?
I don't actually know how that became, how our practice works as a field, but our entire group at the University of Colorado, we all do our own surgery and do our own chemotherapy, and we work very closely with our radiation oncology colleagues so that we can provide very holistic ongoing care.
Oh, I love that. Y'all, she came from Stanford, and when she got out here to the University of Colorado, you were like, I'm staying.
Yeah,
this is the program. This is the place.
This is the division.
Yes, and that's what I want. I want to know that you guys are making so many advances. So thank you for all of your work that you're doing. When we come back, everybody, what treatments are available if you test positive for cervical cancer? It's not the end, everybody. Dr. Lindsay's here to give you some hope. We'll be right back.
Kathie J.
The Colorado Lottery is an official partner of the Kathie J Show. Colorado Lottery, play on.
Kathie J.
Welcome back to the Kathie J Show, everybody. This half hour we've been learning about cervical cancer, from the symptoms to the screenings to the HPV vaccine, and now what you need to know about the treatments. Dr. Lindsay has been here hanging out with us. Thank you so much.
Thank you for having me.
So we were just, real fast before we get into treatments, the HPV virus, I just want to say it one more time. The vaccine that we can get, it begins at 9 to 12 years old is their preference for you to get this vaccine, everybody. What's the percentage? I mean, how effective is it?
So it's essentially at preventing infection with the given strains that it covers.
Yes.
So those 9 strains, including 16 and 18, which are the highest risk. It's almost 100% effective.
Wow.
However, and it takes a while to study these things, because we're talking about a disease that grows over the course of years. We're now seeing in studies both decreased rates of precancerous lesions in the cervix and cervical cancer in those who are vaccinated.
That's
So we are
awesome.
seeing the long-term implication of that as well.
Now, I'm really sad that I'm not available, that you can't get this shot, but actually, older people can now get this shot. Explain that.
Yeah, so just a few years ago, it used to be that the HPV vaccination was available for age 9 up to 26, and they recently expanded it to 45, which is great, particularly for women who have a history of precancers of the cervix or any sort of risk of other, or like history of other HPV infection. It won't treat that prior infection, but it will decrease the chance of you getting another strain of HPV.
Everybody, the HPV, I just want to say one more time, the cancers that it can help 100%, cervical, vaginal, vulva, throat, anal cancer in girls, throat cancer, penis cancer, and anal cancer in boys. Like, this is it's magical. It's amazing.
I don't want to say it's 100%
I know, it's not
because it's very good at treating the strains that it is focused on, so it won't prevent
like
every
you said,
case,
the 9 strains.
but it really does prevent cervical cancer, and that's our goal.
Dr. Lindsay, why is it so important to you to do this work and this research?
Oh, that's a great question. I think that cancer care is, so it's such a privilege to be a part of a cancer care team. I really believe in trying to meet my patients where they are and seeing them through this, what ends up being often a bit of a journey, and it's hard. We started talking about treatments a little bit during the break, but it often involves surgery, sometimes radiation, sometimes chemotherapy, and that's a long process, and you want a partner in that process, and that's really, what I'm here for and what my partners are here for.
Which is amazing, because you don't really hear that. Like the nurse can be the person that's our warm face, but you never really hear that it's the doctors. It's you guys doing the research, making sure that, because you want to make sure that everything's safe for us.
Yeah.
Do you have any connections to this? I mean, you just got into.
Oh, that's a good question too. I've always been, ever since prior to starting medical school, I've wanted to care for women and anybody who identifies as a woman, and that is, or anybody with gynecologic parts, if you will.
Right.
And so I feel like a cancer diagnosis is a life-changing diagnosis, and I want to be there for my patients for that process.
What are the rates with cervical cancer, the survival rates? Do you know?
Yeah, it depends upon the stage. You know, early cervical cancer is curable, and even later cervical cancer, even when it becomes locally advanced, is still has the potential for cure.
Right.
And so that's really what we focus on, and we work closely again with our radiation oncology partners. And the exciting thing is that we are learning more and more every year about how to treat cervical cancer.
Yes.
You know, just in the past year, we've had 3 major publications in major medical journals about new treatment approaches, including immunotherapy in addition to our chemotherapy, as well as a new immunotherapy agent, and another what's called antibody drug conjugate.
Dr. Lindsay, this is where we have to say goodbye.
Yeah.
She could go on forever, everybody. Please go to the American Cancer Society's website, itscancer.org. Dr. Lindsay Brubaker, thank you
for
so
having
much
me.
for joining us today. Everybody, please go get screened. Learn more about the HPV vaccine today. Bye.
It's perfect.
Thank you so much. You did it.